For those of you who want to join us, we're going to get started here with our lunch panel. Certainly, if people want to mingle, feel free to go out in the hallway. We are beyond excited to have such an incredibly rich panel of speakers for our lunch session today. These are our patient advocates. I talk to so many patients who say, how do I get involved? How do I make my voice matter? And these are individuals who have done exactly that. So the format, we don't have a lot of time. So the format for the lunch session will basically be each individual will talk about who they are, their organization, their mission for about 3 minutes. So kind of like speed dating, except we're going to do it in a different setting. And then really, we want to have a good 15, 20 minutes where we can hear from all of you in terms of questions, patient advocacy. It is just so incredibly important. Every voice matters. And the more voices, the more we get done. So on that note, why don't we start with you, Marianne? It should be. That on?
Okay, now. Okay. Hi, everyone. I'm Marianne Pearson. I'm the Senior Director of Patient Navigation and Patient and Family Support at the Colorectal Cancer Alliance. It's a national nonprofit that supports patients and families going through colorectal cancer, but we also do screening for colorectal cancer patient navigation. And so I had to write down all the services that we have because there's quite a bit. But I've been in supportive oncology for about 20 years now. I'm an oncology social worker by background. And so I've supported quite a few families and patients along the way. We also do patient advocacy. We have a group of allies, hundreds and hundreds of families and patients that have gone through colorectal cancer that donate their time and donate their voice to make sure that we are meeting the needs of everyone that we can. And so the services that we have are patient navigation and screening navigation, but we also do we have a financial assistance program for patients and families to offset the cost of care. We also have a clinical trial and biomarker program through Clinical Trial Finders and a company that we work with to help people get tested for their biomarkers. We also have a peer-to-peer support program for mentors and mentees. So if you're seeking out to talk to another patient or caregiver that has gone through the disease, we have trained volunteers for that as well. And let's see what else we have. And then we also have this really exciting platform that we launched in January. It's called Blue HQ. It's a patient-facing and caregiver-facing digital platform that you can become a user in and get all the education, all the resources specifically for colorectal cancer, treatment, diagnosis, genetics, psychosocial support, all of that within a platform that you can navigate. We also encourage people to talk to their doctors. So we give them ideas of questions to ask their doctors when they're confused about their diagnosis, et cetera. But we also, the last thing just to remember about us is we have a helpline that you can call anytime and talk to professional navigators that can walk you through whatever is coming up for you or your family. So that's us. Thank you.
I'm Brian Schertz. I'm with Connect My Variant. I'm a molecular pathologist at the University of Washington by day. And the rest of my time, I'm trying to help families with hereditary cancer reach out to their relatives. So we're all about family outreach and not about your treatment, although we can point you the right direction to some of these other groups to help with your treatment. But we're about helping your relatives who don't know about their Lynch syndrome risk find out about it. So helping you talk to your aunts, uncles, cousins, brothers and sisters who don't want to get tested, children who aren't sure if they want to get tested, all of that, we want to help you do that. So we have family outreach navigators. We provide free genealogy assistance. We provide, and then the unique thing we do is we have a database that when we sign up, we ask about your specific variant, not just MLH1 or MSH2, but like the specific C.dot number. That coordinate, that address is actually could be a key to help finding more of your relatives. Because if two people have the same variant, then the analysis that we've done shows that 90% of the time they have a common ancestor. And so we use that data to connect people up. They can share their family history. Sometimes they find out they're third or fourth cousins. Sometimes it's harder to find out if they're related, but we can help them do like ancestry DNA or things like that. But we do everything we can to help you find out which side of your family your variant came from, so you can talk to the right aunts, uncles, and cousins, the right second cousins even. And we've seen that people have been able to find 4 or 5 or sometimes even a dozen additional relatives who benefit from genetic testing. And we have the technology to prevent hereditary cancer. There's no reason why your relatives have to get cancer. If they can get genetic testing and get appropriate screening beforehand, then they might not ever get cancer. And that's really what our goal is. So that's what we do. I'm happy to talk more. We also have some equity and inclusion mini grants to give people who want to reach out to who are in groups that are underrepresented in genetic testing. And so they can have additional resources to help reach out to their families and to help find their families. So if you're interested in any of that, then do the QR code and sign up. Thanks.
I'm watching the clock over here. She tells me 1 minute, wrap it up. So I will make this as quick as possible. Name is Roger Miller. I'm with Catch It in Time, and we're a group of video professionals, either from broadcasting or corporate communications, and we want to tell the story of the cancer survivors. And our belief is it's not about the quantity of life you have after your diagnosis, but the quality of life. And so we want you to know that you're not alone, and we want you to share your story with other people so they know that they're not alone as well. We have about 9 million views on our stories, both with our website and with other associated websites from the people that we have their stories on, like a gentleman who's a pilot from Red Bull. So we have a lot of views off of theirs as well. We want to help you as an individual or your corporation, your nonprofit organization, help tell their story as well. And I'm kind of like the poster boy for Catch It in Time, because working with Keith, who founded this organization, I ended up noticing some stuff and ended up getting almost 4 years ago at Halloween diagnosed with esophageal cancer. And so that combined with the skin cancer stuff that I have, I'm not the poster boy anymore. I'm the poster senior for this organization. But we want to be able to help people tell the story about catching your cancer in time and awareness of it, and making sure that you know your body better than the doctors do. Let them know that you don't have maybe something in your family, but you may be the first one. It has to start someplace. I have 1 minute left. Oh no, I thought it would be the wrap it up stuff. So anyway, with my particular part of it, I've had so much of the skin cancer on the head and the neck and the forehead, a lot of Mohs surgery. And you know about that. If everyone who knows Mohs surgery, you've had that. I can't have any more of it. I now am going into the Curly surgery and Larry surgery. No more Mohs. So that's Catch It in Time. We want to tell your story on video, and we also do live streaming of events as well. So we want to, for a nonprofit organization, if you have a big symposium coming up, we can tell your story via the live stream. Thank you.
Hi, everyone. My name is Joan Rush, and I'm the president of the Jacqueline Rush Foundation. My husband, Alan, in the purple shirt over there. We started the foundation after our daughter, Jacqueline, was diagnosed with rectal cancer at the age of 20. She had classic colorectal cancer symptoms when she was 16, but her pediatrician believed that you couldn't get colon cancer at that age. So it took 4 years for her to be properly diagnosed with rectal cancer. After she was diagnosed with cancer, she was tested for Lynch syndrome, and she tested positive. And so one of the reasons that we started the foundation was because none of our doctors had ever heard of Lynch syndrome, including my OBGYN, who should have known about Lynch syndrome. So our focus really is on education and awareness, both in the general population, but also in the medical community, especially the primary care doctors, because I feel that that's your first line of defense, really. So, we're trying to put together some education programs in different hospital systems for primary care physicians. So the other thing we do is we provide education and support for Lynch syndrome carriers and their families. And we're building a community so that Lynch syndrome carriers don't feel alone. We have a lot of information on our website, and we really try to connect people with each other who have had similar situations so that they can really relate to someone else. How much time do we have? Am I good? 1 minute? Oh, 1 minute. Okay, let's see. One of the things too I wanted to say is I think in the education area, a lot of families, especially ours, didn't have a lot of cancer in the family. So they wouldn't have been a typical Lynch syndrome family that you would say, oh, there's Lynch syndrome in this family. So that's another thing we want to educate doctors and the general public about. Just because you don't have a lot of cancer in your family doesn't mean you can't have Lynch syndrome. And I feel that I know it's a scary diagnosis to have Lynch syndrome. And I don't know what that feels like because I don't have Lynch syndrome. But had we known Lynch syndrome is in the family, we truly believe Jacqueline would still be here today. So thank you.
Hi, my name is Robin Dubin, and I am the executive director and co-founder of Alive and Kickin'. Founded it 12 years ago with my husband, David, who is a 3-time cancer survivor. And when he first found out he had Lynch syndrome, we started looking for resources and found very little patient education resources out there. And so we've spent the past 12 years building out Alive and Kickin' to provide resources for the patient community. We have quite a lot of different patient education pieces. We've got our podcast, which has been running for the past 3 years, and there's over 100 episodes where Dave interviews patients to tell their stories, interviews professionals. There's actually a number of people in this room that have been interviewed on the podcast, including several on this stage. And some of the leading researchers around the world. That's been very helpful for both patient and professional education. We also have our Living with Lynch patient workshop, which we have an application process. Patients from all over the country apply every year, and we select a small group of about a dozen patients to participate in person. And we do that in partnership with an organization called the Colon Cancer Coalition, who runs the Get Your Ear and Gear races around the country. And we do it each year on the weekend of the Get Your Ear and Gear race in a different city, and partner with different academic institutions to bring their professionals out to speak to our patient group. And we also interview everyone, patients and professionals, on camera to develop video content for the website. So either aliveandkickin.org or livingwithlynch.org, we've got all of the videos that we've produced on a variety of different topics, from understanding what types of annual screenings to get to getting your children tested. And all of those videos are content from the patients that attended our workshop. So it's their stories to hear in person. And I'll be here later if you have any questions. Thank you.
Okay, there's our slide. Hi, everybody. I'm an advisor to fight colorectal cancer. My name is Andy Dwyer, and I'm with the University of Colorado Cancer Center and School of Public Health. But I'm actually representing Fight CRC, and I want to share a little bit about why I have joined in with Fight CRC to help really frame and look at some of their research work, as well as that pairing with advocacy research and really policy initiatives. So about 6-7 years ago, I was really frustrated. There wasn't as much money coming to colorectal cancer, hereditary cancer, Lynch syndrome, as there were to many of the other cancer types, as dollars were devoted to from NCI, DOD, CDC. And I decided that I wanted to share my perspective about things that were happening in Colorado, things that were moving through, the country. And I had an opportunity to go to Call on Congress with Fight Colorectal Cancer as I host an annual kind of on the Capitol talking about colorectal cancer related issues, Lynch hereditary issues. And what really was interesting to me is in the time that I was there, I had a chance with a number of advocates and others to talk with people who were actually supporting legislation to start doing more work for coverage for colon and rectal cancer, Lynch syndrome, as well as people who were opponents, or not opponents, but were understanding really what were the reasons and rationale more dollars should be supported. And I think that really got me hooked on this idea of advocacy, on really showing the outcomes, telling the story, because we had real FaceTime with people who were senators, congressmen, legislators, lobbyists who were making those decisions. I had some chats with Angie Davis and really started to help develop what is called the Research Advocacy Training and Support Program that allows people who are patients, patient advocates, to really go through a formal process to understand how to advocate the science, how to be effective in communities, local, regional, and national, and really to help advocate for the issues that are related to rectal cancer, colorectal cancer, as well as some of the Lynch-affiliated cancers that we've heard so much about today. So I really want to focus that Fight CRC has done a lot with policy and advocacy. I've seen a number of advocates go through these training opportunities, be matched on panels. Lenora is one of the women that is a Fight CRC advocate who actually sits with the American College of Pathologists to talk a little bit about the uptake of screening guidelines for Lynch, sharing a patient perspective. Many of the other advocates that I know and work with are now very much related and really connected into some work that we're doing, where we're starting to look at ICD-10 coding, where hopefully insurance groups and others will still start to begin to really capture how big of an issue Lynch syndrome is, code these sort of information so that we can make system change and policy change. But before we can make these kind of initiatives move and really make it happen, we have to have people who understand advocacy, who understand policy, and really think about how their voices can be most effective in change. So even for this ICD-10 code situation, where it is related to insurance, systems change, in order to put Lynch syndrome as something that insurance companies, others really take serious, really think about coverage, obtaining data, we need people around that table to share their personal stories and impact, because that's what makes a difference. So I'm delighted to work with Fight CRC, who offers patient education, resources, a number of initiatives, a number of partnerships that people that sit here on this panel today. But I really do think that I have become someone who's very much involved in service implementation, research at the university. I've understood that really the opportunity to disseminate and implement and make sure things stick is through policy, but it really takes the voice of many of the advocates who have an opportunity to share that. And what I love about Fight CRC is they provide an opportunity, a platform to learn about that, opportunities for really getting that stage with people who are making a change, and really how to be effective at the state, national, and even local level. Thank you.
Thank you. Thank you so much to everyone for telling us who you are, what you do, your mission. I am truly in awe of what you all have done. So thank you for your efforts. Why don't we open it up to questions? We'd love this to be interactive. We want to hear from all of you in terms of questions that you might have for the different speakers.
I'm also a moderator.
I'm just thinking about the difference between going for your regular screening, a preventative screening with insurance companies, and then the minute that they find something, you are no longer preventative, it goes straight to diagnostic. And I don't know if your organization is working with that, because with most insurance companies, your regular screening doubles or triples in price in order to get that screening done, because they find one polyp and they have to test it. And it just seems like and it might not come back positive or negative, but you're paying, so much, and it might interfere with people going and getting their regular screenings.
I think that's a good point, and there's others that can speak to this as well. So the follow-up colonoscopy bill that was actually passed last legislative cycle is supposed to specifically speak to that if you have follow-up in need for something where you're positive for a stool-based test, or there's something that's found, there should be that follow-up colonoscopy, that it's actually covered as a preventive cycle, not as a prevention, then turn diagnostic. There's also some Medicare loophole initiatives that we're supposed to be shored up as well. What I will say is, in legislation, those things are supposed to have happened. They're really in the implementation component, but there's still a lot of education that has to happen to ensure that that does happen. And I think that's where also policy and advocacy makes a big difference, is we have to make sure that those rules, laws are implemented and enforced. But I don't know, Swati, others, Lisa, or if anyone else has anything else to share about it. What I will say is, watching these processes happen at the federal level, where a lot of this was supposed to have actually taken shape and really been alleviated, there sometimes actually has to be a reinforcement at state houses that this is also something that should be enforced at the insurance company, because a lot of insurance plans are actually more geared towards state level and what's happening for that insurance policy. So I will say that I think that many of the organizations here spend time reinforcing, talking to legislators, talking to advocates. Providers are oftentimes people who are educated and also enforcing, because just because a law is passed doesn't also mean that it's implemented the way that it's intended. But yes, I think it's still kind of a bit of an issue, but some of the legislation that's come through is supposed to have actually helped alleviate that. But in full implementation, we're not there yet. It's a really great point. I don't know if anyone else has something else to add to that.
I just wanted to talk about like support for the young adults. And this kind of goes hand in hand with the insurance piece. So my son was 30 when he was diagnosed, off mom and dad's insurance. Now he's on his own. I have a survivor and a previvor, and their insurance is like $350, $400 a month. Their deductibles are $6,500. They get screened every year. And all of that adds up. And it's almost like so mentally and emotionally heavy for them to even have to think about doing that. And then the cost of it all. And then you've got your deductible and your 20%. Is there anybody out there that can help with that type of situation? I know these 30-year-olds don't have, if your deductible is $12,000 and you're already paying $350, $400 a month, and that's employer shared, how do these kids do this? And then the other second part is just, where do the young adults get the emotional and mental support of it? My boys really struggle.
It's okay if I take that one? Okay. So there's a lot of national organizations that can help people with copays, copay assistance, deductibles. It tends to patients and their family members, depending on the cancer center they go to, should probably talk with an oncology social worker or a patient navigator that is at their cancer centers, or call someone like us so we could walk through those topics for you. it's hard. It's intimidating. It's overwhelming, and people get so discouraged because they're, like you said, emotionally drained. So that's why we're here. That's why supportive care at the cancer centers are there, is really to take advantage of that. The AYA population, or the young adult population, has a totally different level of distress after a diagnosis. So that's also something that most cancer centers hopefully have. If not, have them call us and we'll walk them through. Yeah.
Shelby, because I think Jack, Joan and others. One of the things though I think you bring up is sometimes the issues that are related to patients, unless it's brought to the forefront as an issue, sometimes I don't think people don't know what they don't know about insurance carriers and providers. And I think that's one of the things that I like about what Marianne said and others have said. But I think there's going to be opportunities, right? That if this is happening to your family, it's happening to other families. So I would also say that everyone here has an opportunity that if you share this information and it starts coming forward, it takes all of us to really help advocate for that. So if these concerns come forward, you have the codes, you have people's, because these are the things that need to be fought for. But if it doesn't sometimes reach that level, then people don't know. And if you think you're the exclusion, you're typically not. So I would just encourage everyone that you have, Michelle, you have the entire team, you have a group of advocacy folks here today. When you leave, really be thinking about what you want to do to make change, an idea you have, something that's an obstacle, because this is a group of people who could really help be reactive to that.
So I'm gonna go ahead.
So I also have 2 young adult pre-vivor children that are kind of in a similar situation. And as far as the psychosocial side of it, that is definitely something that is very hard to understand in that context. You're a young adult, and you haven't actually had cancer, so you're not an AYA cancer survivor, yet you're dealing with this cancer predisposition in a very adult way. And that can be very overwhelming. You know, my recommendations are to see if your support system, your providers, your cancer center has some psychosocial support options for individuals that, young individuals that have hereditary cancer predispositions. Sometimes that can help, but that's not always the way that they prefer to interact and receive that help too. So a lot of times it's really difficult to find that support. One of my sons became a mentor through an organization we partner with called Immerman Angels, and they actually connect both cancer survivors and pre-vivors with mentors that are in similar situations. So he has been connected to others his age and with similar diagnoses that were looking for support. So it's one-on-one peer-to-peer support. Sometimes that's an avenue where they're more receptive to finding help and support by talking to someone else that's kind of in a similar situation to them.
On. Okay, there are a few comments about getting the word out, letting more people know. Just want to put another plug for family outreach. Your family members are the people who are going to be the strongest advocates. Right now, the statistics are that maybe somewhere between 10 and 20% of the people with Lynch syndrome in the United States know about it. So that means we're talking 80 to 90% of the people with Lynch syndrome don't know about it. And if everyone who knew about it could reach out to their aunts, uncles, cousins, second cousins, we can help you find out which side of the family it's on, then that gets you to about 80% of the people in the population. So almost everyone in the United States who has Lynch syndrome and doesn't know about it could find out about it if they knew about all of their relatives with Lynch syndrome. And if everyone who knows about Lynch syndrome, if everyone who's diagnosed with Lynch syndrome knows about it, then you also have to count their brothers and sisters who don't have it, and their parents and children who don't have it, but who are immediately related to them. That becomes a big chunk of the population, and that level of advocacy will change policy. So yes, definitely, letting people know about it, but definitely go to the people who are in your families who haven't had genetic testing. Help them get genetic testing, and if you need help with that, then that's what my organization is for, to help with that.
This is absolutely wonderful, and this is exactly what we had hoped for. More questions?
All right. I'm wondering about international efforts for networking and advocating for Lynch syndrome, because, for example, I am an immigrant. I immigrated to Canada, and I've only lived in the United States for 23 years and have no other family in the United States. Are there efforts internationally, or how would you connect with family in other countries?
I certainly, for us, we were forced to be international very quickly, because hereditary disease does not respect international borders. So we have families that are across different countries. We have one woman with Lynch syndrome who's an immigrant from Trinidad and Tobago, and now she has a cousin in Trinidad and Tobago who's she found that she didn't know, but found on Ancestry, and that person has Lynch syndrome as well. And now the two of them are working together to figure out, like, to navigate a totally different healthcare system, totally different testing. So at least for us, then by nature, we're international because we have to be. It's very different depending on where you're going. In Mexico, they're just starting to think about hereditary cancer. And when people get diagnosed, they're oftentimes the first person who's like, if you think you're educating your doctors, then, but genetic testing is becoming much less expensive. We work with a laboratory in Algeria. It's becoming the first testing company in North Africa to do genetic testing at all. Because of the cost of genetic testing going down, then this is becoming something that across the world, people are realizing that this is the easiest way to prevent cancer is focusing on hereditary cancer. And there are international groups, and at least for us, we're international, and we're right now our website's only in Spanish and Chinese, but we're looking at other languages as well. So if you have family, at least in other countries, then family outreach is very easy across countries, and with the internet, it works really well. Others might have other comments.
Just Andy, real quick, we have time for maybe one more question, and we want to give everybody just a couple minutes before the afternoon starts.
Talking here about some connectivity to the ability to pay world and the political world, if I may put it that way. Can somebody address the connectivity to the insurance industry? Is there outreach occurring to the insurance industry? And I'll only use the hundreds of thousands of dollars that was spent on my wife's case of care over the years, when if there had been somebody willing to pay more attention to emerging science, they might have saved a couple $1 million in the last 10% of her life.
I think what you bring up is an excellent point, because I do think right now they're the people who hold really the reimbursement and how people will receive care and how denials are happening. I will tell you that I do know that Fight Colorectal Cancer, especially with their policy group, are taking more and more discussions around roundtable discussions with insurance around coverage, around issues. There's more and more denials, right? I mean, even there's certain groups right now who are coming out who are actually denying moving that guideline from 50 to 45. And we talk about the science and what this really looks like for intake. So once again, yes, I think insurance industry and some of the other entities, it is a big part of, I know, what Fight CRC, Colorectal Cancer Alliance, and others. But what I would say is that for those of you who have a story, who have a voice, bring that, because that's what's going to make that change. I will impress upon people that really a lot of the questions today were really about insurance coverage and what does that mean. And I think that's something that we have to continue, and it is on the radar, but we need more of it. Yeah, so coding is tricky. Swati, I'll let you take that. I do think there is something around coding and knowing those codes and what that means, but it shouldn't be a matter of bait and switch, right? It shouldn't be like you use a code, you do this. There really has to be a comprehensive policy so that it's done and it's done well, and so that we don't have people who slip through the cracks because someone coded it incorrectly. So I do think there is something to the coding. I can't speak to it as a clinician, but I do think many of the initiatives right now that are policy advocacy related are also having discussions about insurance. What does that mean? Because ultimately, as the gentleman who just asked, and then your questions, this makes big difference in people's lives.
The only thing before we wrap that I'll add to that question is from the clinician side of things, and I work with many of you on this, sometimes it's a game of whack-a-mole, you know, that we find a code that works. We use it every year. Our nurse navigator knows it. And then all of a sudden, 2 years later, we get some, you know, like Andy said, bait and switch. So yes, we will continue fighting the fight, writing the letters, whacking them as they come. But the bigger picture is working with organizations like Colorectal Cancer Alliance, Fight Colorectal Cancer, Alive and Kicking, all these organizations that are advocating for really quality metrics and policy level change so that we don't have to keep doing this, because otherwise the goalposts change, the rules change on us.
Well, and you know, as I have listened to all of you, and thank you so much for your time and for being here today. What keeps coming in my head is it takes a village. It really takes a village. I think so many individuals and their families, they feel like they're alone. It is a lot to process. It's a lot to deal with. And you are not alone. You've got a ton of organizations and resources and providers out there who are here to help you, and every voice matters. And what? Yeah.
Sometimes you advocate for yourself doesn't come naturally, or asking proactive questions that come because you're in a fear state, or you're so overwhelmed. So please, if I could tell you anything, is to reach out and position out your cancer centers, your patient advocacy services. You don't have to ask the question. We're here, but I was shocked. For 20 years, I built programs and people did not know they were there, like walking in the hall. And I like tried my best for 20 years and people would say, I didn't even know you guys were here. And I'm like, oh my gosh. And also when it comes to billing, there's care coordinators, there's billing coordinators. You kind of have to go find it. And I hate that for you, because I want it to be very evident. So they also have insurance navigators. We do that as well. We might not have all the answers, but we can think of questions for you. So that's another thing just to remember when you're at your cancer centers, when your family gets diagnosed, when your friends get diagnosed, see what resources, search them out. I know it's hard, but they're there.
They are there, and it takes a village, and that is why we are all here today. This is an incredible village, and we are so thankful for all of you today. So let's give our panel discussion another hand.